Hi and welcome. This is a congestive heart failure educational activity. If you are viewing this video, it is likely that you have been diagnosed with congestive heart failure. The purpose of this video is to provide insight on congestive heart failure to patients so that there is a clear understanding of the diagnosis. It will also provide answers to questions and make the patient feel more at ease. Please feel free to pause the video and jot down questions if there are any that come to mind and ask your medical provider. The learning objectives in this activity are as follows. Number 1, the definition of congestive heart failure. Number 2, statistics of congestive heart failure. Number 3, causes and risk factors of congestive heart failure. Number 4, symptoms of congestive heart failure. Number 5, diagnosis and maintenance of congestive heart failure. And number 6, preventing a relapse of congestive heart failure. Congestive heart failure, according to the American Heart Association, is a progressive condition in which the heart muscle is unable to pump enough blood through the heart to meet the body's need of blood and oxygen. The medical term for this heart squeeze is known as the ejection fraction and is measured as the percentage of blood that is pumped through the heart. A normal ejection fraction is 55 to 60%. To meet heart failure criteria, anything less than 50% ejection fraction is considered heart failure. It is important to know your ejection fraction and to provide this information to all of your medical providers. Although being diagnosed with heart failure sounds scary, there are over 5.1 million people in the United States that have heart failure and lead an active and normal life while being treated for this condition. Next, we will discuss the risk factors and cause of heart failure. The onset of congestive heart failure usually is because of coronary heart disease, which is a buildup of plaque in the arteries of the heart, as well as heart attacks. Coronary artery disease is the most common cause of congestive heart failure. Risk factors including high blood pressure, as well as diabetes, smoking, eating foods high in cholesterol and sodium, not getting enough physical activity, and obesity can cause congestive heart failure. Poor management of these risk factors increase the chance of congestive heart failure's onset and severity. Now that we know what heart failure is and how it is caused, let us discuss the symptoms of heart failure. Common symptoms of heart failure include shortness of breath during normal activities, weight gain, with included swelling of the lower legs and ankles, and our stomach region. Usually a feeling of weakness or tiredness is associated. Other symptoms may include persistent cough or wheezing. A lack of appetite and or nausea may be noticed as well. Weight gain is typically the first sign. This weight gain occurs relatively in a short period of time, from 24 to 72 hours, of approximately 2 to 3 pounds. If the symptoms begin to occur, cardiologists and or other medical providers should be notified. Let us now discuss how heart failure is diagnosed. Usually, when a patient presents to the medical provider's office with the symptoms described as above, it is the first inclination to the provider that heart failure may be occurring. A complete history and physical will likely be done if not already known. Vital signs will be taken and a series of tests may be run. These tests include a blood test, chest x-ray, exercise stress test, cardiac catheterizations, as well as echocardiogram, which will provide information on the ejection fraction. As described above, if the ejection fraction is less than 50%, heart failure is diagnosed. Although it is possible for your ejection fraction to be normal and still show signs and symptoms of heart failure, in this video we will only discuss the heart failure caused by decreased ejection fraction. There are several treatment options that your medical provider may prescribe. Initially, lifestyle changes such as losing weight, monitoring daily fluid intake, avoiding or consuming minimal amounts of alcohol, eating a heart-healthy diet, being physically active, and managing other medical diagnoses are recommended. The next treatment option is medications. These medications are prescribed for the maintenance and stability of heart failure. Medications such as angiotensin-converting enzymes, known as ACE inhibitors, angio-2 receptor blockers, also known as ARBs, beta blockers, calcium channel blockers, diuretics, commonly referred to as water pills, such as Lasix, vasodilators, and statins for cholesterol management are normally prescribed for those who have been diagnosed with congestive heart failure. The successful treatment of heart failure ultimately depends on your willingness to be involved in the management of your condition, the compliance of the therapy that has been prescribed by your medical provider, as well as the necessary changes in the diet, exercise, and lifestyle modifications so that the highest quality of life can be obtained while living with this condition. Finally, to prevent a relapse of congestive heart failure, medical providers often request from their patients a daily log of their weights, blood pressure, and glucose so that records can be kept while in the home setting and brought to their healthcare appointment. Laboratory data is often performed at a minimum of 3 to 4 times a year to evaluate the kidney function as well as other specific information. Follow-up appointments with your medical provider should be maintained, as well as prompt notification to your provider if any of the above signs and symptoms begin to present themselves. Thank you for viewing this video. I hope this clears up some of the confusion and provides a better understanding of heart failure. Please note that this is not to replace your medical follow-ups and that the information is provided as a learning tool and not meant to replace your medical provider. Your condition may require changes to treatment therapies and may be different from those listed above. Thank you and have a great day.